Welcome to the video. Advances in behavioral genetics require reinventing psychotherapy. My name is Dr. Stephen Bacon. I'm a clinical psychologist in Santa Barbara, California, and I've spent the past decade writing books and researching exactly how psychotherapy works. Behavioral genetics. Recent advances in behavioral genetics have radically challenged the assumptions underlying psychotherapy. To understand how and why, we have to understand a bit about the genetic influences on behavior and the DNA revolution. Years ago, when I attended graduate school, I was taught that genetics were responsible for 20 to 30% of behaviors in psychopathology. The latest research shows that it is actually responsible for 50% on average. In addition, it appears that genetics influence virtually all of our behaviors and traits. Quote, "In fact, it is no longer interesting to show that another psychological trait is heritable because all psychological traits are heritable. A sign of how much the situation has changed from the last century's environmentalism is that I do not know of a single psychological trait that does not show genetic influence." The DNA revolution. Behavioral genetics has spent decades using twin adoptive studies and other tools documenting the importance of genetic influences on behavior. The DNA revolution, in contrast, is the attempt, based on the 2003 decoding of the human genome, to predict future behaviors from individual genomes. This effort progressed slowly through 2015. That's because they were trying to find 7 or 11 or 13 genetic differences that might predict something like depression or schizophrenia. Unfortunately, this approach never predicted much more than 1 or 2% of the effect size. This changed when they began to do GWAS on large data sets. The big surprise is that complex behaviors are predicted by variations in 1,000 to 4,000 SNPs. Implications of 4,000 genetic predictors. If every complex behavior or trait has thousands of genetic predictors, the implication is that every diagnosis is a spectrum disorder, not a binary one. More specifically, this means that everyone has a polygenic score on the schizophrenia scale, or the depression scale, or the sociopathy scale. Symptoms of a disorder occur when an individual's vulnerability interacts with their stress level. When I have a high genetic score for depression, I will show depression symptoms with a relatively small amount of stress. Quote, "Genetic research shows that the medical model is all wrong when it comes to psychological problems. What we call disorders are merely the extremes of the same genes that work throughout the normal distribution. That is, there are no genes for any psychological disorder. Instead, we all have many of the DNA differences that are related to disorders. The salient question is how many of these we have. The genetic spectrum runs from a few to a lot, and the more we have, the more likely we are to have problems." How many diagnoses? DSM-5 has almost 300 different diagnoses. How many discrete diagnoses are there from a genetic perspective? Put another way, how many of these 300 diagnoses are genetically identical? To answer this question, geneticists use multivariate genetic analyses to investigate the genetic links between pairs of disorders. The first discovery is that anxiety and depression are identical genetically. Environmental factors determine whether one shows anxiety or depression symptoms. Quote, "Hundreds of studies later, the genetic architecture of psychopathology suggests just 3 broad clusters, in contrast to the dozens of disorders in psychologists' diagnostic manuals. One cluster includes problems like anxiety and depression, which are called internalized problems because they are directed inward. The second genetic cluster, externalizing problems, includes problems in conduct and aggressiveness in childhood and in adulthood, antisocial behavior, alcohol dependence, and other substance abuse. Psychotic experiences such as hallucination and other extreme thought disorders form the third genetic cluster, which includes schizophrenia, bipolar disorder, and major depression. Implications of diagnostic changes. Seeing depression or sociopathy as spectrum instead of binary disorders will change the way we understand mental health. If everyone is on the spectrum for every mental health diagnosis, then no one is really sick and no one is completely free from pathology. Psychology needs to relinquish its assumptions about lifelong disorders. We can't call anyone a schizophrenic or an alcoholic anymore. There are no normies and no mentally ill. There are only humans who are on a continuum. When we stop identifying a person with a disorder, you are a sociopath, rather than, quote, your current stress is eliciting sociopathic behaviors, close quote, then we will avoid reifying a person. We will avoid self-fulfilling prophecies. The corollary to spectrum theory is the idea that healthy functioning can be restored for almost anyone, except perhaps for individuals who have extreme polygenic scores. Implications for treatment. Conceptualizing psychopathology as an intersection between genetic vulnerability and stress emphasizes the concept of current stress. If that can be reduced, the symptoms will disappear. In this sense, psychotherapy should be present-oriented as opposed to past-oriented. The concept of evidence-based treatment is called into question. First of all, evidence-based advocates are claiming effective treatment for diagnoses that aren't independent or even real, for diagnoses that are genetically identical with other diagnoses. How can an intervention be evidence-based if it is unclear what diagnosis it supposedly remediates? Personality disorders need to be seen as more situation-dependent and less stable. Moreover, the genetic analysis implies that PDs will have variability in their symptoms. For example, someone might act like a borderline at home where there is a lot of stress and be relatively free from borderline behaviors at work. Similarly, a borderline woman might be quite healthy at the beginning of a relationship where the honeymoon glow decreases stress and then manifests borderline symptoms later. Searching for environmental effects. We have already learned that genetic influences account for approximately 50% of all psychological characteristics. This means the environment or nurture accounts for the other 50%. The effect size of intentional environmental interventions, the character development strategies employed by families and schools, can be measured by genetic research tools. More specifically, when children are adopted at birth, if there are systemic effects from families and environment, there should be correlations between adoptive parents and adopted children. This correlation measures the effects due to nurture or environment. Weight in adopted versus intact families. One of the simplest studies of this type has to do with weight. Since adopted children learn about food and eating patterns from their adoptive parents, there should be some correlation between adoptive parent weight and adopted children weight. Quote, the correlation between weight of parents and children is about 0.3 in control families in which parents and their children share both nature and nurture. Is this similarity in weight between parents and their young children a sign of nature or nurture? The CAP results provide a clear and consistent answer. The weight of adoptive children does not correlate with the weight of their adoptive parents. Their correlation is just about zero. This means that dietary and lifestyle differences of adoptive parents are not at all related to the weight of their adopted children. Similarly, siblings correlate about 0.3 for weight, but when two unrelated children are adopted into the same home, their correlation for weight is near zero. Growing up in the same family does not make children similar in weight unless the children share genes. IQ in adopted versus intact families. Similarly, if environmental interventions at an early age can influence intelligence and problem solving, then there should be correlations between adoptive parents and adoptive children. Quote, by 16 years of age, the correlation for intelligence was the same for adopted children and their biological parents as for children reared by their biological parents. The correlations between these adoptive children and their adoptive parents, who share nurture but not nature, hovered near zero. Divorce in adopted versus intact families. In addition, the probability of divorce should be correlated between adoptive parents and their adoptive children, given that these children learn a great deal about intimacy and connection from their home environment. Quote, "It has long been known that the offspring of divorced parents are more likely to get divorced themselves. Possible environmental explanations leap to mind. For example, living through their parents' divorce causes children to have relationship problems, or because they do not have good models for a stable relationship. However, a recent adoption study in Sweden showed that the link between divorce in parents and divorce in their children is forged genetically, not environmentally. For a sample of 20,000 adopted individuals, the likelihood of divorce was greater if their biological mother, who did not rear the individual, had later in life become divorced, than if the adoptive parents who reared them had become divorced. Families intentionally build character. One of the primary assumptions of psychology is that healthy families build good character and dysfunctional families contribute to bad character. Alas, the research fails to support this fundamental concept. Quote, "The absence of evidence for shared environmental influence has been found not only for traditional personality traits like extroversion and neuroticism, but also for traits that might seem especially susceptible to parental influence, such as altruism, caring, and kindness. These traits are components of a factor that personality researchers call agreeableness. I had always assumed that these traits would show shared environmental influence. Unfortunately, subsequent research has not confirmed this finding, and I reluctantly admit that even agreeableness shows no influence of shared environment. Grit is another personality trait that has been thought to be due to shared environmental influence, but it also shows the same results as other personality traits: moderate heritability and no shared environmental influence. Nurture does not teach children to be kind or gritty. Summary of nature versus nurture. The genetic research did find some family-related nurture effects in the area of politics and religion, but virtually nowhere else. Moreover, geneticists make an extensive argument that schooling is equally impotent. The conclusion is that good schools and good families provide positive experiences while one is there, but there are no lasting effects on character, good or bad. Quote, "Parents obviously matter tremendously in their children's lives. They provide the essential physical and psychological ingredients for the children's development. But if genetics provides most of the systemic variance and environmental effects are unsystemic and unstable, this implies that parents don't make much of a difference in their children's outcomes beyond the genes they provide at conception." Trauma and life events. Traumatic events and people's response to them, especially PTSD, are considered the ultimate environmental event. How can genetics influence random traumas, like a car accident, death of a loved one, or a rape? Quote, "We were surprised to find that identical twins were twice as similar as fraternal twins in their scores on the measure of life events. The same pattern of results emerged for the twins who had been reared apart in different families. These twin correlations suggest that inherited DNA differences account for about 30% of the differences between people. The fact that there are genetic factors in trauma perception and response shouldn't really be a surprise. Some individuals pride themselves on taking harsh events in stride, while others consciously or unconsciously amplify them. Similarly, some recover quickly because they have things to do, while others hold on to an identity of suffering and victimhood. Trauma's lingering effects. Trauma is a highly charged topic in psychotherapy, and personal growth, and it is useful to examine it more closely. Behavioral genetics sees trauma the same way it sees all environmentally intentional interventions. These experiences influence an individual in an up or down direction while they exist. However, they have a half-life. That is, while they influence a person for a period, after they are no longer present, that influence decreases over time as the individual regresses to their genetic norm. In the case of trauma, this means that there is a degradation of functioning at the time of the trauma, a degradation which lasts for some time, depending on the severity of the trauma. Speed and level of recovery from the trauma, however, are determined by genetics. This simple idea becomes complex when viewed from a lifespan perspective. More specifically, individuals who are challenged in the area of trauma recovery already have multiple unrecovered traumas active in their life. This creates the illusion that the presence of traumas causes low functioning, when in reality, it is the genetic dysfunction that causes the low functioning. Resolving trauma. In contrast, individuals who are genetically disposed to good trauma recovery are in fact traumatized for a period following the trauma, but essentially recover from it. And of course, individuals who are moderate in their trauma recovery abilities fall in the middle. What this implies for trauma theory is that trauma is serious and disturbing and should always be taken seriously, but we need to remember that long-term symptoms occur due to genetic vulnerability and environmental stress. In the case of individuals demonstrating sustained effects from trauma, this is less due to the severity of the trauma and more due to a stressful environment. Make the environment healthier and the trauma should remit. Pay particular attention to current environmental factors, secondary gains, that support a traumatized identity. Well-known trauma approaches, for example, EMDR, cognitive, or psychodynamic, work, but not because they treat the past trauma. Remember that genetics has shown that the intentional past doesn't affect the present. Rather, they work because they serve as rituals in conjunction with the therapeutic alliance that give a client a positive bump and temporarily improve the environment. Therapists can continue to use such approaches, but they will be more efficient and effective if they understand that they are affecting the present environment, not the past. Structure. This emphasis on the impotence of past intentional interventions has another significant implication. Since ongoing positive functioning is supported by positive structures, it is incumbent on psychotherapists and personal growth seekers to establish such structures if they wish to sustain gains. Much has been written about the primacy of the individual identity and the decline of group identity. More specifically, sacrificing personal freedom to sustain connections to family, spiritual institutions, or community organizations is not as desirable as it once was. Psychotherapy unconsciously supports this trend by teaching that we can replace maladaptive individual strategies with functional independent strategies and all will be well. This is in sharp contrast to earlier ideas that a person is incomplete without a strong identification with a group. The sense that I could only be a real person in the context of my connection to my family, my clan, my religion, or my national identity is rapidly fading. The genetic findings argue that psychotherapy is making a mistake when we weaken such factors. We need social structure to sustain gains. Sustaining gains. If positive schools and positive families give a sustained bump up during childhood, it seems logical to seek our equivalent institutions to sustain mental health gains in adulthood. This is reminiscent of the Buddha's three refuges, where they feel that the example of the Buddha and the message of the teachings would be inadequate without the presence of the Sangha, the community. It also speaks to the Christian quote, "For where two or three are gathered in my name, I am there among them." Psychotherapists all endorse the concept of understanding a client's social system and using it to sustain gains, Unfortunately, this principle takes second priority to the concept of healing individual traumas, mislearnings, and misconstruals. Instead of being trauma informed, we need to be genetically informed and systems informed. In this sense, all therapists would do well to adopt the perspective of social workers who are trained to understand that sustained improvement is often dependent on helpful social structures. Psychological systems. Virtually every psychotherapeutic school sees the root of psychopathology in the past. In response, every school then develops techniques to remediate these maladaptive past learnings. For example, psychodynamic psychotherapy uses working through techniques where key traumas are understood and released. CBT identifies dysfunctional strategies and replaces them with helpful tools and functional cognitive strategies. Since we now know that nurture is incapable of building long-lasting strategies from events, instruction, or the sustained interventions of schools or families, we have to realize that these remediation strategies are not changing anything that actually exists. Clients say they are helpful, they report feeling better, but the cause of this improvement is not the remediation of traumatic events or poor cognitive strategies. In sum, every psychological school is built on a false premise. Techniques or rituals. The genetics findings suggest that our vaunted techniques are more usefully understood as rituals. Used in this context, a ritual can be defined as a quote prescription or a series of actions that are believed to remediate an underlying condition, close quote. The key word here is believe. Rituals are powered by beliefs. Techniques have inherent power and work whether we believe in them or not. An antibiotic works whether we believe in it or not. However, a placebo only has power through expectations and beliefs. Evidence-based interventions sound like techniques, and most therapists and clients believe they have inherent power. However, if they really were techniques, then they wouldn't be based on false premises. In addition, 300 different techniques wouldn't all work and work equivalently. If techniques have inherent power, they should achieve different size effects. Rituals, conversely, would have the same effect size, as they are powered by beliefs, and every school presents ideas that are believable. But psychotherapy works. In spite of the fact that our diagnoses, our interventions, and our causal assumptions are revealed as constructed fictions, we do know that many people benefit from psychotherapy and report feeling better and experiencing decreased symptoms. The extant explanations of why people get better are clearly wrong. Fortunately, we have an alternative explanation, the Jerome model. Psychotherapy works when there is a high-status healer who approaches us with wisdom and kindness, offers an explanation for our problems, and prescribes a set of actions designed to remediate the problem. The Jerome model. The Frank model explains why psychotherapy works, even though it is based on false assumptions. As long as clients see the therapist as high status, wise and kind, and as long as they believe the explanation and the rationale for improvement, they will get better as they move through the prescribed action. We should note that Frank designed his model to explain both psychotherapy and other forms of healing. For example, Frank's explanation works as effectively for exorcisms as it does for psychotherapy. Given the insights offered by behavioral genetics, it should be clear that our psychotherapeutic interventions are essentially as valid or invalid as exorcisms. Put another way, psychotherapy clients improve through faith and belief. Our explanations and interventions are no more real than those of the exorcists or other shamanic healers. Genetics validates the constructionist findings. As has been pointed out in previous videos, the constructionist conclusions are virtually identical to the genetic findings. More specifically, constructionism argues 1. Techniques lack inherent power. 2. Psychotherapy's privileged knowledge is unrelated to outcome. 3. Psychotherapeutic interventions are healing rituals, not scientific techniques. And 4, psychotherapy takes place in constructed reality, not in fundamental reality. The genetic findings independently validate the constructionist conclusions that arise from analyzing the training and experience effects in psychotherapy. Explanations. A one-sentence definition of constructionism in the context of psychotherapy would go something like, human suffering is inevitable, but the explanations for that suffering are as variable as human cultures. The genetic findings fully endorse this sentence in that the inability of problems, pathologies, and traumas to create sustained negative effects reveals that all of our explanations for suffering are constructed. And how can any interventions have inherent power when they are based on false explanations? When our explanations are constructed and our interventions are constructed, it is no wonder that our privileged knowledge is unrelated to outcomes. In that sense, of course, Frank is right when he compares psychotherapy to the shamanic methodologies of other cultures and argues that all of our mental health practices are rituals and all our improvements are based on expectations and beliefs. It just feels wrong. Previous videos have pointed out that these kinds of conclusions simply feel wrong. In fact, it is just this kind of blind adherence to simple feelings of right and wrong that have sustained the misconstrual that psychotherapy is a scientific discipline. One of the classic critiques of religion is that humans cannot handle ambiguity. As a result, they need to have simple explanations that provide predictability and reduce anxiety. In the West, we want our psychology to work like Newtonian physics. If we know one fact perfectly, we should be able to generalize from it and derive the entire universe. Put in psychological terms, mental illness has a simple cause, a dysfunctional past, and a simple cure, remediation of that dysfunction. Those individuals who can throw off this common sense delusion have real opportunities to be more effective both as therapists and as personal growth seekers. Validation and extension. The geneticists are calling for a reformation in how we understand and practice psychotherapy. The constructionists are making an identical demand and have reached similar conclusions using an independent path. In this sense, the anti-common sense conclusions of both approaches reinforce each other. In hindsight, the fact that there are no sustained effect from intentional or traumatic environmental forces should have been obvious. The lack of inherent power in intentional psychotherapeutic interventions is simply a form of it. Yet even for the committed constructionist, it seemed too challenging to dismiss the family or schooling as incapable of creating lifelong effects. In this sense, the geneticists have not only validated constructionism, in actuality, they are saying something like, I'll see your 500 and raise another 500. A path forward. However frightening it might seem to reject our extant understandings of human pathology and human growth, there is reason to be optimistic. It is true that genetics are difficult to alter. However, we should remember that symptoms are the result of genetics plus environmental stress, and that stress is overt, relatively easy to quantify, and, in that sense, relatively easy to change. Moreover, all of our current improvements are based on rituals and flawed assumptions, and people still get better. Imagine how much more quickly and effectively individuals can be treated when we actually understand how psychotherapy works. In sum, we are certainly operating in challenging times, but we finally have a map and compass to help us navigate from here to there.